Ventura County for the past 10 years has done exercise of this magnitude that have brought these responders together and actually created an opportunity for them to network and talk and have the hard conversations about what works and what doesn't, to analyze process to improve our survivability, if you will, in an actual disaster. The integration of volunteers with first responders and setting them up with instant command structure and those kind of constructs is critically important. As we've evolved, now it becomes more integration of the different types of volunteer organizations out in the community, your CERT teams, your DART teams, your emergency response teams, your spontaneous volunteers, your medical reserve corps. They become critical players in the bigger picture, and it's something that we rely on. And this is why we do these kinds of events, to continue to educate them and kind of bring them into the fold as far as disaster response and in support of our community. The conceptual idea behind the whole build was a 3-day event wherein day 1 is education, day 2 is a full-scale mass casualty incident drill, and then day 3 was sort of a team building thing, and we actually had our Western Regional Conference on this particular one for our Medical Reserve Corps. The goal of day 1 of this exercise was to educate responders and receivers and volunteers from within the community on a variety of different medical subjects. The subjects being taught were everything from the statistics of ballistics to Trauma 101, from start triage to decontamination. Simultaneously to all these trainings was a demonstration by our Sheriff's Helicopter Air Unit that showed participants how to safely work within a helicopter landing zone and the nuances of landing and safely interacting with a helicopter.
And hold right there, main and tail are clear, no factor. Hands are on the skid. Feet are on the skid. Climb it inside.
There's also a class on animal evacuation taught by our animal services group, and there was also a class taught by ReadyNet on patient tracking and hospital status. There was about 40 classes that it covered everything from start triage all the way through water purification and various different subjects related to patient care in a disaster specific to hospital response personnel.
The logistics of dealing with a disaster like this on a long-term basis are incredibly challenging, and you have to drill, you have to practice, and you have to do it in a realistic way. And that's exactly what our disaster partners here at the counties do.
9. No, it's 6.
Day 2, we had our mass casualty incident.
Engine 155, utility 50, medic 494 responded, injured person at the RTC.
At 9:30 a.m., we had patients in the field calling for help, having just been struck by a 9.2 on the Richter scale.
We can start getting some documentation done. If we started the triage, I'll make you the triage unit leader.
Showing a size up, we have numerous victims. We'll go ahead and upgrade this to a level 2 MCI at this point.
One of the important things that we were trying to capture, and one of the goals and objectives related to this event, was what happens to a patient that suffers a catastrophic bodily injury in a true disaster, and that patient, our sample patient per se, has catastrophic burns. And then they get picked up by the field responders and they get treated.
He's definitely our most critical right now. So 1, 2, 3.
Let's check right out.
And then they get packaged and shipped to a medical center that most likely after 9.2 is in surge capacity. So they see that patient and they greet them.
What's your name?
Hard.
Okay, you feel nauseous, like you want to vomit? No? Okay. Let's take him down first. If we can get IV access, great. If not, I'll put a fem line here. It looks like that's probably the only thing that's not burned.
And they triage them, and they discover that they don't have the facility, nor their facility is not prepared at that time, based on the other surge going on, to treat that patient. So then they discover that that was a high candidate to be moved out of the county. So then you see that patient being transferred and given a report to the military, and then from the military being loaded on a large format vehicle and transferred to the airframe for evacuation out of the county of Ventura.
I'm here because our first mission in the National Guard is to respond to emergencies here in the homeland. Our job is to fight and win our nation's wars, but we deliver value back to the state by participating in exercises like this to be ready when emergencies happen. Very impressed with how cohesive the interaction is between the private hospitals, between the first responders, the emergency managers, and the military that we have here. It's amongst the best that I've seen.
It is important to note that we make a habit of exercising our actual plans. This being said, several plans and policies were tested during this exercise. We accomplished this by inserting SMART objectives that included aspects of our mass casualty policy and medical surge plans. The ensuing After Action Report, or AAR, will be used to revise these plans, and in doing so, make them more operational.
Well, today what we tried to do is simulate a 9.2 earthquake that's struck Southern California. The coordination between agencies, I don't think you can overstate it or overdo it. I think that the more you get together, the more you train, the better you get. And I think the takeaway today is that if we were to have an emergency, I know that all the agencies that were here today are going to be able to perform a lot better just by the training that occurred here today.
Day 3, Ventura County Public Health and Emergency Medical Services hosted the Western Regional Medical Reserve Corps Conference for the Western Region of the United States. The event started with a team challenge course that had a variety of unique medical challenges to challenge a built team, and then it culminated with some speeches and presentations from the state and federal partners that are involved in Medical Reserve Corps.
Ventura County has done a fabulous job in preparing this exercise. You know, communication is usually the major challenge when there's an emergency. And if we can get different organizational structures to respond together and speak with each other and understand each other and integrate with each other, we have a much stronger emergency response.
Well, in Ventura County, just watching the way this has been organized, it's an opportunity that not many communities get as a whole, to bring all of their response partners together and to work through that. And Ventura County has capitalized on that by bringing many players together, but then offering them an environment of learning and practice.
Ventura County Public Health is very proud of the effort we put forward with regard to these kind of events. It's important to note, though, that it's not without the support of the federal and state partners that this even be possible. So we're very thankful for the contributions that they provided, and we're grateful for the grant funds that are being offered.